Hi, I'm Dr. Madhusmita Misra. I'm the Chief of the Division of Pediatric Endocrinology at Massachusetts General Hospital and the Talbot Professor of Pediatrics at Harvard Medical School. This is Understanding Anorexia Nervosa and the Body. So how does anorexia nervosa affect your period? A large proportion of adult women and teenage girls with anorexia nervosa have irregular or absent periods, and the risk of having a loss of periods increases as body weight decreases. In conditions of energy deficit, the body needs to conserve energy for the more vital body functions. So in conditions of energy deficit, the brain shuts down the reproductive axis, and this manifests as a loss of periods. Now, when body weight is low enough that the reproductive axis shuts down, leading to a loss of periods, fertility is impaired. And the extent to which fertility is impaired depends upon the extent of weight loss, and this improves with weight regain and a resumption of menstrual periods. Women with anorexia nervosa and low body weight can conceive with the help of fertility-inducing drugs. However, it's highly recommended that these women get to a healthy weight before they conceive because of a very high risk of miscarriages, preterm births, and low birth weight infants in low-weight women with anorexia nervosa. We have many groundbreaking studies from our unit that have shown that estrogen deficiency leads to an impairment in cognitive status, an increase in anxiety scores and scores of eating disorder psychopathology, and all these measures improve with estrogen replacement. We now know that normal estrogen levels are very important for normal cognitive function, for reducing anxiety and optimizing eating behaviors. These data very clearly indicate that weight regain and menstrual recovery should lead to an improvement in all these measures because of a normalization of estrogen levels. One of the most profound consequences of anorexia nervosa is a decrease in bone density, a decrease in bone strength, and an increase in the risk for fracture. And in teenage girls with anorexia nervosa, we do not see the increase in bone mass that typically occurs during the pubertal years, and this has very long-standing effects on bone health. So these are cross-sections of bone from the forearm in a girl with anorexia nervosa at the top and a healthy weight girl at the bottom. The more the red in bone, the weaker the bone, and we can see that the girl with anorexia nervosa has much more red to her bone than the normal weight girl who has normal bone strength. Among the factors that contribute to low bone density in anorexia nervosa are the decrease in body weight per se, the decrease in muscle mass that accompanies the decrease in body weight, and the hormonal consequences of low body weight. The extent to which bone density recovers depends upon how quickly anorexia nervosa is diagnosed and treated. So the earlier the diagnosis, the earlier the treatment, the more complete is a recovery in bone density. However, if the diagnosis is delayed, or if the management is delayed, or if there are many relapses of low body weight after weight recovery, then the improvement in bone density tends to be less than optimal. Now, in addition to the reproductive, brain, and bone consequences of anorexia nervosa, there are also consequences with respect to the cardiovascular system and the gut. Unfortunately, we do not have as much data for men with anorexia nervosa as we do for women with anorexia nervosa. However, we do know that men with anorexia nervosa are also at a very high risk for low bone density and at an increased risk for fracture. And so for men, just as for women, it is very important that the diagnosis be made early and that the management be instituted early. So if you or a loved one has anorexia nervosa, there is hope. The best strategy we know of to reverse all these consequences that I've been talking about is weight recovery and menstrual resumption. And the best way to achieve this is to have the diagnosis be made early and management to be implemented early. So thank you for joining me today. I'm Dr. Madhusmita Misra, and at MassGeneral Brigham, we are here for you.